comfortable，他们会插东西进去拿里面的 specimen 的。
OK。
没有结婚，可能他不太 comfortable 嘛，去找女医生做。那结了婚
，klinik kesehatan 都有 FOC 的。
那 klinik kesehatan 的米西出乳到死那也可以。
所以 klinik kesehatan 出乳没？
不懂啊，你进去多看到。我们
丽丽都已经去。
kesehatan 的。
还我吓到，我以为你们叫我才要去 klinik kesehatan 帮忙查看。
你就想，你读多5年拿多一个cert出来先呐。
你读多5年拿多一个cert是吧？
拿多一个cert就随便你要怎样看，你看到可能你看到怕不啦，心里恐惧人家。
恐惧吗
？Vincent现在不会恐惧啦，Vincent哪也会一个不了嘛。应该妇产科医生会恐惧哦，我想。好，可是妇产科医生也有结婚生孩子啊，应该不会恐惧到怎样啦。
等一下你问医生看哦。
等一下我问一下，这个是 cancer 的医生，那个 Dr. Imran 啊，我的家婆鼻癌嘛，也是看他的。他很好一下的嘞，其实他，想一些问题问他问那个 PET scan 最近多少 case 那个 agent 其他公司的 AIA 的你知道吗？中招这个 customer 没有中了鼻癌嘛，中了鼻癌没有买 waiver 给他有医药卡没有 waiver 的医药卡 package 来的。然后老婆的也没有，他还是被 policy owner 就是他买给老婆，可是 payer benefit 又没有放然后他买给孩子的也是 payer benefit 都没有放，所以他现在中了 cancer 不能被 premium 要照工然后他就看中这个 Great Eastern 呢，其中一张就是其中一个就是我们有 PET scan 和 MRI outpatient 从那一边他看中这一个，然后他就想把他自己不能了啦，他的老婆、他的孩子、他的姐姐都转过来只有姐姐是 non-standard 现在在 attend QE 剩下的都生效了。
几张啊？这样多大
？4张4张，可能还有2张他姐姐的孩子还在 follow 着。
好谁啊？
一个 agent 做错一个 point 不了，然后嘛，不知道怎么没有放 premium waiver 给他。
他几岁啊？他买那份保单的时候？
他买那份保单其实才5年 ，AIA 的那份保单才5年前签的。
他几岁的时候买那个 waiver 呢？买这份保单呢？
他也是5年前才换的，他5年前的保单是ING 的 standalone medical card。5年。然后所以他的那个 cancer 的
几岁了呢？5年前是几岁了
？5年前是45岁吧。
45 waiver 应该好 OK 啦，给 customer 做决定啦，看他要不要加，毕竟也是要一点点价钱。
不太贵，你可以给
他选给 customer 选。
有 waiver 和没有 waiver 嘛，45岁应该不太贵，我觉得。
要给 customer 选择。50-60岁就贵了，50多55以上我就很少加了。
对，如果50-60岁的可能我们就 plan 1 plan 2了，有 waiver 和没有 waiver 的，
给他自己去看
对哦，说做错一个这一个，然后第二个呢就是他 admission 他现在的鼻癌发作第2次也是已经好了。然后已经好了之后这个鼻癌他不是要每一年 PET scan 呢？然后我们旧的保单 PET scan 的时候去怎样 claim？ 跟你们
就是大家可以问看
admit claim 对了answer 是对的。我们旧的保单也是 admit claim 的嘛，只有现在新的保单这一张SMS 才有那个 PET scan 是可以 outpatient claim 了嘛，旧的保单都要 admit claim 的。这样 他的 AIA 也没有跟他讲，他就自己去照了这个 PET scan，然后 AIA ก็在 claim 冇可以咯。那对没有给他了哈，他就 AIA 就拿一个 gloss 哈，在他 cancer 的那个 policy 的 cancer 的部分哈是写prevention 的东西，他写 prevention 是不 entitled to claim 的，然后他就去调查了这个东西哦。Prudential 也有这样的 clause，AIA 有这样的 clause，这医生没有哦，他就找到我，这个人也是我current customer 的弟弟来的，current customer 的弟弟。那 current customer 以前在他店做工的时候，我也是会整天问他，uncle 你的东西啊，买什么公司啊？他每次也是拒绝我，我买了，AIA 买很多了啊，不要踩我的这样。然后这一次是自己叫我去看他 policy 了，然后才开的。红险来。
这样他这个 PET， 他这个 MR， 他这个 PET scan 那些，如果到时要 claim 是 doctor 是写 support letter 吧，是不是？就是我 suspicious customer 有这些需求，然后我就 claim outpatient 哦。
对呀 ，medical necessary 嘛，因为cancer 不是要 follow 过你等下我可以问 cancer 的医生这一题咯，因为他不是 female 有 cancer 吧嘛，他是所有的 cancer 这个医生是不是后面的PET scan 每一年 regular follow up 的entitled to claim 是 by admission。
你要问他 scan 的时候有没有那个辐射，其实
scan 有没有辐射，应该会有吧？
辐射
多多少少
就在
多多少少会有
吧。
因为普通 MRI 不是也是会有了呗？
有的 X-ray 都有一些的，多还是少罢了。科技越来越好，就越来越少咯。这样 Phoebe 问的是 after 的哦，这样 before 的呢？如果今天是还 customer
suspect 不了
suspect 不了，这个是 doctor 应该也写得到那个，写下来了。
然后我们换那个tukar language 啦。Kak Iza.
Hello. Kak Iza boleh dengar Kak Iza?
Hari itu kawan saya masuk admission guna itu saya member kan, privilege member kan, first time guna lah. Admission deposit tak ambil bilik memang ada 2 orang sajalah. Tapi okey lah, customer pun happy with it, tak ambil duit dengan dia, dia sudah happy. Dan kalau kalau pinjam ni bayar sikit saja lo, bayar medication yang dia ambil tu.
Supplement ke mungkin?
Tak tahu supplement ke macam mana lah. Tapi kalau customer kita mau admission boleh immediate register lah.
Hari tu bagus. Nanti encourage lagi ejen-ejen lain untuk register dalam itu insurance connect kalau ada klien yang admit.
Itu first time TB gunakan itulah.
Bagus.
Dia counter sana tak cakap apa pun, TB show dia itu card saja. Card bukan physical card itu online card.
Virtual. Sudah cukup dah, daripada faham dah janji depa nak itu record. Kalau tak tunjuk susah nak record nanti.
Lagi itu dia mau duduk hospital COVID tak charge dia pun.
Betul.
Macam tu saja customer happy, cik.
Betul. Pun suka dah. Baguslah.
Boleh lah. Kita tahu dah, nanti Kak Iza bagi lagi special sikit lah.
Boleh. Kalau dia orang aktif guna itu, nanti kita ada banyak lagi reward lain.
Kalau aktif guna, matilah. Setiap kali mau masuk hospital baru aktif mah.
Bukan aktif tu means memang pernah guna itu sajalah. Setengah ejen langsung tak tahu. Dan dia tak mau try. Dia tahu dia ada tapi dia tak nak try. Dia tak nak log in pun. Bila log in situ, I boleh capture. So anything, ada apa-apa event ke reward apa nak bagi, dan kita cari ejen yang ada dalam insurance connect lah, senang.
Oh, macam tu.
Hmm.
Bolehlah Phoebe active one.
Betul.
Boleh.
Okay. Sekejap, doktor belum ready kot. Kalau tak, nanti dia masuk terus lah. I dekat rumah, dia pun dekat rumah juga.
Boleh
Sebab
je
malam
fleksibel.
kan.
Fleksibel.
Kita pun change kita punya ini meeting semua on rumah sajalah. Sebab kalau kita pergi fizikal takut itu crowd tak banyak sangat. Kita try guna Zoom lah.
Betul.
Doktor
Zoom pun
boleh.
okey, tapi cuma tak ada macam not so close lah. Sebab kan nampak doktor dalam kita punya Zoom saja. Kalau face to face tu lagi close, lagi lama lah dia punya talk selalunya.
Lagi mesra sikit. Kan.
Kalau siapa yang dah pernah jumpa doktor, it's okay lah kan. Just kita nak dapatkan info terbaru, semua macam tu saja.
No, sekarang nanti tanya doktor imunoterapi ST sudah ada tak?
Apa? Nanti tanya doktor. Ada, I rasa. Nanti tanya doktor. Nanti boleh tanya.
Boleh.
Dan kita pun untuk your information lah, kita pun ada banyak lagi doktor-doktor baru. Kita ada sekarang neurosurgeon yang baru kita ada. Lepas tu kita ada itu pakar paru-paru, pulmonologis Sanggita.
Pakar paru-paru.
Paru-paru kan batuk lah apalah. Tapi Dr. Sanggita sekarang ni sessional lagi. Dia belum join as resident lagi. Tapi dia akan join as permanent lah lagi 3-4 bulan kot. So dia physician, so dia more to pulmonologist lah, paru-paru punya masalah respiratory. Dan lepas after COVID semua banyak masalah kan, then boleh refer dia.
Masalah paru-paru.
Saluran pernafasan. Sesak nafas, batuk, lambat lega kan. Sekarang ada banyak orang yang prolong punya kesan selepas COVID pun banyak juga. Lepas tu kita ada pakar bedah thyroid juga. Thyroid kan. So dia ialah selalunya thyroid general surgeon boleh juga, tapi sekarang kita ada pakar bedah thyroid, dia lagi spesifik lah dengan thyroid punya pembedahan.
Okay. Boleh lah.
Itu yang terkini lah, doktor baru kita yang terkini.
Banyak sekarang doktor.
Banyak lah sekarang. You tengok kalau you main pantai kan, bilik doktor pun banyak sekarang kan.
Betul, sudah extend kan.
Mau pantai tak ada tempat parking sekarang. Susah.
Kena sabar dulu, nanti kita buat bangunan baru ada parking punya tempat.
Nanti ada
banyak layer punya.
Parking tak apa, Kak Izzah. Janji ada booth kasih.
Ada
booth pun saya bagikan.
Booth pun kena ada. Akang pergi buat booth punya station sana.
Betul, nanti I tengah propose untuk masuk dalam hospital pula. Sekarang kan kat luar kan.
No, panas kesian.
Panas, kesian. Kita kena tengok siapa yang kuat tahan. Itu kental punya kita bagi nanti special.
Betul juga, nanti kalau kita pergi itu make up sudah
cair lah.
I
tengah propose dekat management untuk letak kat dalam lah, sebab sekarang kita dah ada banyak OPC punya ruang tu, ada banyak-banyak tempat yang lapang sikit lah, sebab patient kan ramai, nanti terganggu pula patient. Betul. Doktor sudah join.
Okay.
Doktor sudah sampai?
Sudah.
Doktor sudah join tu.
Sudah masuk. Tapi doktor punya mic mana? Tak ada mic doktor.
Lepas kita bagi doktor masa sikit lagi.
Mungkin doktor baru habis makan saja pun.
Yalah, baru sudah solat sembahyang lagi.
Lagi sembahyang baru boleh masuk.
Betul.
Cerita dengan kita. Boleh. Adalah doktor sudah ada mic dia.
Okay. Gambar saja belum? Okay lah, 21 participant. Agent pun sudah ready.
Hello, good evening.
Hello,
good evening.
I spotlight doktor dulu.
Nice to see all the familiar faces.
Hi, Doctor.
Bibi.
Now can see without mask. Outside need to see with mask.
Doktor kenal you.
Doktor mesti kenal ya. Mak mertua cari sama doktor sudah sehat sekarang. Hari masak.
Oh, masak dah lama betul.
Dia sudah boleh masak every day. Exercise.
Yes, very good, very good. Happy to hear.
Okay saja dia steady.
How very how.
Ho lah.
Oh, excellent, excellent. Okay, so how do we...
Doktor boleh
Yeah.
nak share slide kan? Doktor kan share slide kan?
Yes, yes.
Doktor cuba tengok. Asal kita punya technical dia sudah turn out.
I try now.
Tengok boleh tak? Okay.
Boleh.
Look well.
Look well, huh? Okay.
Yes, semua clear.
Okay.
Tak ada lag. Mungkin doktor boleh you try next few slide and see dia smooth tak? Okay.
Okay, can see
Okay,
ya?
Okay, nampak.
Janji dah tak hang.
Alright. Okay.
Okay, so basically, thank you doctor for coming and also Kak Iza for coming. So doctor also ready, then without hesitated, hari ni kita akan start kita punya sharing lah for our topic of the female cancer. Then hari ni kita ada Dr. Shazril Imran dari Pantai Hospital Sungai Petani. Thank you for coming and also kepada semua agent-agent, buddy-buddy, even customer yang main, thank you for coming. And today kita hari ni ada doktor akan share lebih detail pasal common cancer in women. So tanpa kita melengahkan masa, I pass the floor to Dr. Shazril. Hello doctor, it's up to you.
Thank you so much. A very good evening to everyone. Thank you to our Mr. Chairperson, a very good looking Mr. Chairperson.
Thank you.
Leng Chai lah, Leng Chai.
Thank you, doctor.
But we are not talking about Leng Chai today. We are talking about Leng Lui lah, common cancer in Leng Lui lah, in females. Okay, so our talk structure is I'll give around 30 minutes to 40 minutes talk. And you can feel free to stop me at any time if you're not feeling sure. Of course, this is a sharing session, so we can make it casual. And anything that you're not sure about, just let me know. Okay, so after that, we will have a Q&A session after that. If anything that you want to ask later. Okay. So the topic is common cancers in women. So women cancer lah. So the women cancer, we want to talk about what are the cancer that is related to the women. Of course, logically, the organs that women have and the male don't have will be included in the women cancer. But women cancer is not exclusive to that, which means that cancer that happen to men can also happen to women as well, except for things like prostate cancer, where women do not have prostate organs. So in Malaysia, the top 5 cancer for women, number 1 is the lung cancer, the breast cancer. And you could see the number of cases is very high, 18,000 patients per year that we're seeing. So it's a lot. 1/3 of women cancer is breast cancer. So meaning for any cancer doctors like myself, the breast cancer is the bread and butter lah, meaning we have to know in and out how to manage and so on. Number 2 after breast cancer is the pator one lah, colorectal. So the pator one. So usually the breast cancer, the symptom is, if you want to advise your client, symptom is any lump. Usually the breast lump bo tia one, painless. Memang painless lump, and many people shy to come early until it get bigger. When it get bigger, then it will have tia one or bleeding. Then that one is too late lah. So normally like angmo, they are very smart. Usually any lump, small biji also they come early. When you come early, your stage is low, stage 1. So when you come early, your cure rate is high. The problem with we people in Malaysia, we tend to come a bit late. So when we come late, usually stage is higher already, stage 2, stage 3, and so on. The pato cancer, the colorectal cancer, the symptoms usually, when you pangsai, there will be blood. Or you pass mucus mucus when pangsai. Or normally if somebody who pangsai every day, suddenly pangsai once every 3 days. Pangsai, laosai alternating. Or after pangsai, they feel that they want to pang again they feel that they haven't complete emptying themselves So that is a colon cancer symptom. So that you need to advise your clients. Number 3 is the cervix and uterine. This is the female organ. Okay. Now the cervical cancer is something that you can prevent nowadays with the vaccination. That's why now in school, Form 1, Form 2, they give the HPV vaccination is to reduce the risk of cervic cancer. It can reduce the risk for as much as 90%. It's a lot. So for example, there are 4,000 cases of cervic cancer in Malaysia. If everyone in Malaysia go for the HPV vaccination, for the 4,000 one per year can become 400. 90% reduction with the HPV vaccination. So all family members are advised to go for HPV vaccination. Number 4 is the ovary. The ovary is the kilang where all our hormone is being created for the female. This is the factory where we produce the female hormone, the estrogen, the progesterone. That's when we get the period. So any imbalance in your period also can affect your ovary. Then the last one is lung cancer. So lung cancer, phase 1, although it is mainly for men, but women also can get lung cancer. Not because women are smoker, but they are passive smoker. So it's very sad. It's very sad to see that women are getting lung cancer because the husband is a smoker, or because the other family member is a smoker, or the son is a smoker. Pity them. So the husband or the son doesn't get cancer, but they get the cancer. And normally the problem with lung cancer, you don't get it in the first stage or second stage. Lung cancer is very bad cancer to have. So if you can be alive with lung cancer for 2 years or so, you are considered very lucky already. If lung cancer stage, usually stage 3 and stage 4. Very rare you get lung cancer stage 1, stage 2. Okay, so with in regards to the treatment of the cancer, what are our cure rates? You can see the chart. Nowadays for breast cancer, the cure rate is 90%, which means that if you have 10 of your clients breast cancer, we can safely say that 9 will survive and but 1 will die Whether you do chemo or whether you do surgery or whether you do radio, whatever you do, out of 10, 9 will survive Last time, out of 10, 7 will survive From 74%, now it's 90% already. So with the current treatment, especially in private hospitals, you can get better treatment. Your chances of cure is 90% now. If you look at the other cancer for women, the uterus one, 86%, the cervix one, 69%, the pato one, colon one, 66%. And if you look at the bottom part of the list, the 4 worst cancer to have, one is pancreas, number 1, pancreas. Out of 100 people, only 8 will be alive. Pancreas, 8% cure rate, not like breast cancer, 90%. Then the number 2 one is the KUA one, liver one. So the KUA one, 18%. Out of 100, only 18 will be alive 5 years. And then number 3rd one is lung cancer. So lung cancer, out of 100, only 18 will survive. Then number 4 worst one is the esophagus one. Usually, if patient have this kind of cancer, the bottom 3 one, we say if they have a family, if the patient have anything that they want to do, bucket list lah. They want to go for holiday ka, they want to huahi themselves ka, they want things to do for themselves. Let them enjoy life lah. Pantang also bo pantang already, no need already lah. Those kind of things. Okay. So then we zoom in into breast cancer. So the breast cancer, this is the UK data show that we are getting better and better. In the 1970, our cure rate only 50%. Then 2005, 85%. And now it's getting to 90%, as I have shared earlier. So then the question comes, is this represents the data in Malaysia? Now, when they did study for 2000 and 2005, the 5-year cure rate in Malaysia, this one is in government hospital is around 49% only. So bosyang with the cure rates in UK. So if you put that data into this graph, actually we are 40 years behind the data in the UK. So UK data 52% in 1970, ours is 49%. So a lot of things that we have to do. That's why if you have medical card and so on, you can say that your survival is better in private because you can have access to better treatment and better drugs. Okay, so the reason why we are 49%, there's also patient factor, meaning patient come late. Like I've said earlier, Angmo, they have lamon, straight away they go. Whereas we sometimes the tumor very big, bleeding, then they come. So I'll show you some pictures later. So lack of awareness, that's why we have to raise their awareness, and lack of access as well. And also they prefer alternative therapy. Sometimes they go and see their sensei first. We see that in Kedah, there are people who go for alternative therapy quite a lot. And some because of socio-economic reason, meaning bolui lah, meaning to go and see lokun also, they think many times. So they go for cheaper option first. Then lack of social support also got. The healthcare factor is accessibility to cancer centers. In our northern region, the only cancer center is in Penang. Yeah, patient from Perlis, Kedah, Perak, Northern Perak, Taiping, they have to go to Penang Island to have their chemotherapy. There are some small center having chemotherapy in Alostar, but they are not fully there. In Kedah, there is no cancer specialist in government hospital. No cancer lokun to give chemo lah. So they come from Penang once a month or once a week. So they are not full there all the time. And we also have problem with the waiting time to go to government hospital to have treatment for cancer. Sometimes they have to wait up to 6 weeks. And 6 weeks is quite a long time. So that's where if you have a medical card, it will be better if you have treatment sooner. Because 6 weeks can allow for stage 2 to become stage 3. Sometimes 3 to become stage 4. And then accessibility to newer drugs. New cancer drugs can be very expensive, especially now after our ringgit has fallen against the US dollar. For lung cancer, for example, oral tablet treatment can cost sa chap cheng call 30,000 ringgit per month.
Tablet per month.
Per month. So one day 1,000 you consume per one day 1,000. And this is same for the other women cancer like ovarian cancer also. There is a tablet which is Jichap Go Cheng. So 25,000 per month. I spoke to one auntie today and we advise her to have this treatment. Then that auntie, she said, I got 4 children. She spoke to me in Hokkien. They say, I got 4 children. My 4 children, all their salary combined also are not enough to buy medicine for me though, 25,000 per month. So it's, but the medicine is very good. People can cure more, can live longer more, but no choice. So she has ovarian cancer, but she's 76. Her insurance only go chap cheng. So in terms of to buy the medicine, 25,000 per month, 2 months insurance finish already for the annual limit. Okay, and adaptation to latest evidence practice lah. Meaning to say, to adapt to new practice, it is costly for the hospital, it is costly for the patient also. Skills and expertise as well. So cancer specialists also, there are not many in Malaysia. So that's why we have problem in access. Okay, so we move on. So how bad it can be? So this is a picture that that I want to share with you. So this is a breast. This is a patient's breast. And it doesn't look like a breast anymore. Normally, if a breast has a shape, this one is like a cauliflower shape, and you can see that there is pus, and from the whole blood is coming out. So this is easily stage 4 already. If I feel like this, I no need to do CT scan. Also, we know it's already stage 4. Stage 4, can it be cured? No, can tahan only lah. But you can see miracle. Nowadays, with the treatment, this kind of breast lump, this 15 centimeter breast lump of tumor, can go back to normal size. It can go back to normal breast shape. We have done before with radiotherapy, with neo-targeted therapy, and patient get back to normal. We have patients achieving that. So there are many of our patients, they get to this stage. So the bottom line is, don't live until late. No? Easy to remember for us. If any of your client asks, hey, I've got stage 1, what's my cure rate? And then you can look very smart by remembering this slide. It's a 90, 70, 50 rule. Stage 1, 90%. Stage 2, 70%. Stage 3, 50%. Stage 4 cannot cure already. So easy to remember, 90, 70, 50. So stage 1, 90% cure. Stage 2, 70% cure. Stage 3, 50% cure. Stage 4 cannot cure already. Okay. So stage 4, there are patients who are, nowadays we can cure stage 4. But normally it's only 5%. Out of 100 patients, 5 can be cured. 95 patient will cure 1. Okay. So then how do we stage the cancer? If the breast cancer, if let's say stage 1, the tumor is very small, less than 2 centimeter, we call it stage 1. Number 2, stage 2, if more than 2 centimeter, but less than 5 centimeter, that one becomes stage 2. Stage 3 cancer, when it goes to the nearby lympha, the lymphatic system. And stage 4, when it spread to other organs. Meaning it, from the lung, it goes to the lung, or it goes to the brain, or it goes to the bone. So if breast cancer goes to the brain, patient will appear like somebody who is having stroke. They get one-sided weakness. They cannot talk. Sometimes they get slurred speech and so on. Now, if somebody has got cancer spread to the bone, to the kut, they get kutia. So basically, pain here, spinal pain, non-stop one. Some patients, they present with back pain. Then we do CT scan, CC is from lung cancer or is from breast cancer. So these are the things that we measure. And some, if the cancer spread to the liver, usually they become yellow, they become jaundice. They have no appetite to eat, they lose their weight, and then they become very bolat, then become very skinny. So what causes cancer in women? Genetic, meaning if their family got cancer, meaning to say if your parents or your grandparents or your cousin or your uncle or your auntie has got cancer, or your siblings got cancer, you may be at risk of getting cancer. And number 2 is environmental. Environmental has to do with your diet. So what is your diet? What is your lifestyle? What is your job? Stressful job, not stressful job. For example, if you are working night shift, somebody who works night shift, late up night, still working, 2 o'clock, 3 o'clock in the morning, that one you are putting yourself at risk for not just cancer, but heart problem, diabetes, and hypertension. So healthy lifestyles play a lot of role. Cancer is a defective DNA disease, meaning whatever something does, your DNA rosak, and then you get cancer. So we know 30 to 40% cause of breast cancer, 60 to 70% happens for no reason. So for lung cancer, breast cancer, traditionally the treatment is surgery. Last time you have to remove the whole lung, meaning you have to remove the whole breast and you get a scar. Nowadays, we don't do that anymore. If we can remove the lump only, we can spare the breast, we spare the breast lump. Meaning we just take out the lump only. Now we don't remove the breast anymore. Take out the lump and then we give tian radiation. This is a picture how the patient having tian. Patient lying on the couch and then the machine will give laser treatment and kill the cancer cell. So you save your breast. If you have breast cancer, you don't need to get your breast chopped. You just need to remove the lump as long as the lump is small. Many patients, you might notice that they don't want to see the doctor because they kanchong. They kanchong is like, wow, if I go to see the doctor, I'm sure my breast gonna chop one. Actually, not true. Nowadays, we don't chop the breast anymore. Last time, yes. But for the past 10 years, we don't do it anymore. By removing the lump only and then we give tian, it is as good as removing the whole breast. So you can spare the breast. So we see a lot of patients where they don't want to see the doctor. They go and see the sensei because they don't want to get the breast chopped. So we don't want this anymore. The top pictures, what we want is a normal breast. Yeah, okay. This is, we do see this quite often. You can see that the cancer is such a big cancer. This one easily like a apple size already, the cancer tumor, 10 centimeter. This one easily stage 3 already. So it's normal and for us to see this, quite common. And this is automatic stage 3 because it is more than 5 centimeters. Sometimes if the tumor is too big, then we give chemo first. Chemo also people kanchong. Some people say, do chemo one time, sure die one. And that actually not many people die of chemo also. Very, very rare. So do tian one time, sure die one. This is all the myths that you will hear from the public. Actually, we use chemo to shrink the tumor before patient go for surgery, or we give chemo to prevent the cancer from growing again. Normally, I will tell my patient, this cancer is like the weed, it's like the lalang. If you take out the lalang already, if you don't give the weed killer, the racun lumpai, sure the lalang will grow back again. So giving chemo is just like giving the weed killer to mati all the akak-akak. So basically to mati the lalang so that it doesn't grow back again. Okay. And what's the problem? The chemo is patients lose their hair. They get hair loss. But the hair loss is temporary, it's not permanent. Some patients, they have gray hair. After chemo, the gray hair turn black also got. Some patients, the hair bosui after chemo and the hair become very wavy also got. So I think this is something that you have to face it, but face it in a positive manner. Then they have scarf, they can wear wigs and so on. Now the problem with breast cancer stage 4, we cannot cure already except for 5 in 100 people, 5%. Who is the 5%? We don't know, only God knows. But we can try our best. So it depends on where the cancer has gone. If the cancer gone to the bone only, they can still live for years. For 4 years, 5 years, they can still live. But if cancer go to the other important organ, go to the guam, go to the face, or go to the brain, it is a very serious issue. Normally, if the cancer go to the brain, normally the life expectancy is 6 months, even if you do anything. If go to the guam, depends. Some patients can live for a few years still, some patients few months. So we are unable to cure stage 4 cancer at the moment in majority, but we make it like a chronic disease, just like diabetes. Once you kena diabetes, you cannot be cured. So we tell patient that if you kena stage 4, just like you kena diabetes. which means that you live with it as long as you can control it lah. But once the cancer become out of control, then the patients will die of cancer. So you just tahan only lah. But more treatments are coming and more patients are living longer. So that one is the breast cancer. We touched about the breast cancer. Now the second most common cancer in women is the colon cancer. So how does a colon cancer look like? So as I mentioned earlier, when the patient pangsai, they can panghoid lo. So blood coming out from the tumor, and we do a scope. If let's say scope, you can see there's a tumor there bleeding from inside. So normally the area is the rectum near to the pangsai area. That's why sometimes people cannot pangsai also. It's a very alarming symptom. So what do? We have to see the surgeon. They have to cut the area of the cancer in the pathol and then join back lah. Sometimes can join, sometimes cannot join. If cannot join, then patient need to pangsai from the back. This is example, a young man having pathol cancer is very near to the pangsai area, so the surgeon cannot cut and join back, meaning the pang has to come from the back. No? The problem with the back is you have to pantang your makan. Sometimes it may look a bit nasty. Sometimes it may leaking can happen. Sometimes you go makan function, then the back bursts. All the side will wet your trousers. So it is a very trauma thing to live with. Imagine living with that for the rest of your life. Nobody wants to pang from the back. So this is an issue as well. And it can happen to women as well. And nowadays, we don't let the surgeon touch you first. Meaning we give Tien first. And in 10 patients, now is 3 patients will get complete response. Meaning the tumor disappear with Tien only, no need to do surgery. 30%. And no need surgery if it does not recur. So we are saving this patient from having a permanent back. Meaning they don't need to live with pangsai through the back. They live normally and they are healthy. Then we go on the next cancer is the women cancer, the cervix cancer, which is related to the human papilloma virus. So viruses can also cause cancer. The common virus is the HPV 16 and 18. This is where the vaccine comes in for the cervical cancer that we give for people 13 years and above. Yeah, so this one that I mentioned earlier, it can reduce the risk of cancer by 90%. What are the other risk factors for cervical cancer is if the female is smoking, you can get cancer. If the female has multiple sexual partners, that one can lead to cervical cancer. If they have a sexual intercourse at early age, meaning the cervix is not ready for sexual intercourse, but they go for sexual intercourse. If they are in the lower socio-economic group, or if they have HIV, meaning AIDS. So these are things that can cause cancer. So HIV also can cause cancer. How do cancer of the cervix present? This is very important for women to know. Sometimes they notice after they have sexual intercourse, they have bleeding. So after they do intercourse, they bleed. It's not a common sign. It's not a common normal symptom. It is a symptom that is very alarming. So if having after intercourse they have bleeding, they have to see the gynecologist to get it checked, no? Or if let's say in between the period they bleed. If their period is every 28 days, suddenly after 1 week finish period, they have tampok, they have this a bit of bleeding. That one, do not think that is normal. Even in patient with after menopause, like auntie all 70-year-old, 80-year-old suddenly having bleeding, that one do not consider normal. It is cancer until proven otherwise. So they have to check with the gynecologist. Dyspareunia is pain during intercourse, meaning if when they're doing intercourse, they have TIA, or if they have abnormal vaginal discharge, or they have back pain. If back pain, cervical cancer, usually stage 3, stage 4 already. So these are the symptoms. And what we do for screening, that's where the pap smear comes in. So not many people in Malaysia go for the pap smear, but the pap smear is warranted in those 25 to 64 years old. So if you are young, you should go for every 3 years. If you are above 50, you should go for every 5 years. And usually the invitation in UK is being done by the GP. Here is your own initiative now. So better go and have your pap smear done occasionally. You can detect cancer at a very early stage. Then you can spare from all the unnecessary chemo, unnecessary radiotherapy, unnecessary surgery. If very early stage, the surgeon need to remove only, no need to go under operation. Remove but in the clinic only. So that's what we want. Okay, so the diagnosis of cancer of the cervix, they have to check your cervix area. They have to do a vaginal examination. They have to do a MRI, a CT scan, and a blood test. And also, they have to do HIV screening, just to make sure that you are not getting cancer because of HIV. The reason for there are many types of cervical cancer. Most common is the squamous cell carcinoma, and there are many other types as well. Now, this is a picture to show where the cervix tumor arises. You can see here in stage 1, is very small. 1B is only less than 4 centimeter. 1B2 more than 4 centimeter. Stage 2, the tumor gone to the vagina already. Stage 2B gone to the vagina from the cervix but gone out already. Stage 3, it gone out already. You can see the tumor outside already. And stage 3B, it gone to the bone. Gone to the bone, you get a bone pain when you're walking. Stage 4, gone to the pangsai area where you have difficulty to pangsai or you get back pain. So this is a symptom of cervical cancer. Usually, if early stage patient go for hysterectomy, meaning they remove the womb, so they cannot get pregnant anymore. So stage 2 also same, they go for surgery. But comes to stage 1B, they have to go for TIAN, chemo and TIAN altogether. So every stage will have different treatment. I won't bore you with that. If becomes stage 4, usually the life expectancy, they can live 1 year with chemo and so on, only 1 year. So we call it palliative care, only prolong time, and then if they have wish, we complete their wish. So, and then we ask question about radiotherapy. Radiotherapy is where we give TIAN radiation, and it is common that we give radiation to cervical cancer patient. How does the TIAN works? The patient lie on this expensive machine from Germany, and this machine costs around 12 million easily. To build the whole system is around 14-15 million. And the treatment is only 5 to 10 minutes per day. Patient has to go for multiple times, up to 33 times. On the way, it works with okay, that's how the machine works. Meaning the patient stay at one point, the machine encircle the patient and give TIAN at all angles. When it gives TIAN, bo rasa one. But then after you do a lot, then you get the skin breakdown, you get the skin redness, then you get difficulty in that organ area. Okay, so now we go. Okay, so next slide. I won't bore you with this. Okay, now we did mention about chemotherapy. So what is chemotherapy? Chemotherapy is where you put medicine into the body, either injection, either oral. We have oral chemotherapy tablet as well, or there are other methods of chemotherapy that we can give. We also give chemotherapy to the spine or chemotherapy to the brain. So there are many types of chemotherapy. Some chemotherapy will have hair loss. Some chemotherapy will have no hair loss. For stage 4 breast cancer patient, meaning to give chemo just to buy time for them to huahi, to be happy, we give them option. So, auntie, you want to, there's few options for the chemo. If you don't want to lose your hair in your remaining life, then we give chemo that you don't lose your hair one. So they're also happy they have options to choose. So recently, so last week I had one patient, 50-year-old, and she doesn't want to go for chemo because they want to lose hair. Then I counseled her, there is chemo that you don't lose hair one. Then she agreed. Initially, the chemo very big. Now she started chemo, she's very happy already. No side effects. So there are 70, 80 types of chemotherapy, and every chemotherapy has got different side effects. Right? So this is how a patient with radiotherapy to the cervix looks like. So we give TIEN to the cervix area. Usually the side effects to the cervix area is lousy. On the cervix area, you can get skin redness. And when they puncture time, they can get burning or stinging when they puncture. But otherwise, they are well and healthy like that lady. She can still smile. Okay, so we use computer system to determine which area we want to TIEN. So we not just saja TIEN one, it's a very highly specific treatment where on the CT scan, the oncologist will draw on the CT scan and tell the machine, oh, I want to TIEN this part, I don't want to TIEN this part. Make sure the TIEN don't kena this part. Make sure the TIEN kena this part. So it is a very highly complicated system that we use. Brachytherapy is another system where we give TIEN from the vagina, meaning we put this metal inside the vagina and we give TIEN from the metal applicator. That one can be quite hot inside, and patient has to do in operating theater. So oncologists also, we go into operating theater if we are giving brachytherapy. We use this for cervical cancer and cancer of the womb. So we put TIEN inside rather than outside. This is how it looks like when we give TIEN from inside. Okay. So in terms of some patients after chemo, after radio, should they go for cervical smear? They shouldn't go for cervical smear because the result is incorrect already. So these are the common cancers that we have touched. It is a very big topic to talk about all female cancers, but I think we have given a bit of flavor. The cervical cancer, the breast cancer, the bladder cancer, and what about prevention? We don't want to kena cancer in the first place, no? So what are the general tips for good health is avoid obesity. Don't become fat. So if you are slim, your risk of cancer is low. If you are fat, your risk of cancer is higher. So be slim, eat healthy food, and do regular exercise. So what should we do in a circle of healthy living? The circle of healthy living starts with think positive, meaning we plan our life. Not to say that we work will not finish. We need to have a balance of life. So think positive first. Okay, I want to live a good day today. So what do you want to do? Then the next one will, I want to eat better. I want to eat healthy food. And I don't want to eat food that can be harmful to me. Then exercise often. How much exercise should we do? It is advisable to have at least 1 hour every alternate day. So meaning 3 hours per week, if you can. And then exercise will make you feel good. When you feel good, you will think positive. So the positive chains continue of the healthy living. So this is what we should do. And scientific evidence show that if you exercise will cut down risk for 13 types of cancer. And exercise automatically will reduce your risk of cancer by 30%. So 30%, whether you do exercise in the morning or in the afternoon. But if you do in the morning, if you get the sunshine, your risk of cancer reduce further. Because the morning sunshine are very sui one. Very sui. The morning sunshine got a lot of vitamin D. And if you have a lot of vitamin D, studies show people with high level of vitamin D are very hard to kena cancer one. So patients with people with low vitamin D are easy to kena cancer. So the natural way of getting vitamin D is from sunshine. The problem with us, unlike our grandparents or unlike our parents, they work in outdoor, they work in paddy fields, plantation. They are exposed to sunshine when they work. We are sitting in our office morning, so no sunshine one, bosui lah. So basically, we have to get a lot of vitamin D. If you cannot get sunshine in the morning, what you can do, you can take vitamin D supplement. I myself am taking vitamin D supplement, 1,000 unit per day. And study in Germany show that if you are taking vitamin D, you can reduce your cancer risk by 42%. So it's good. Vitamin D are not expensive also. 1 month only, Ji Chap Ko, Sa Chap Ko only. That will save you from getting cancer treatment of Ji Chap Cheng or Sa Chap Cheng per month. So it's a very wise investment lah. Take vitamin D3, 1,000 unit per day. That will be my advice lah. So exercise, take vitamin D. It's very good. Food wise, you can eat anything but in moderation. But what is bosui? Bosui for cancer is processed meat loh. So any meat that come from factory, bosui. Number one, because you don't know whether the meat is fresh or not. It may be lying on the factory shelf for months. The meat might be 3 months or 6 months old. You want fresh meat is sui lah. Bo fresh bo sui lah. So sausages like burger, all the fish cake lah, all the fish finger lah, all the crab meat, everything not advisable. So any meat from the factory not advisable lah. Don't eat too much, don't eat too little, also be in moderation. Good idea to cut down on red meat lah. So chicken, fish is healthy. You can have your red meat, but don't take always. How much red meat can you take? Normally they advise for Malaysian not more than 70 grams per week. So how much is 70 grams? If you're ordering a steak, beef steak for example, so one plate of beef steak usually is around 150 grams. 150 grams. So if 70 grams meaning you share the beef steak with your partner lo, don't finish alone lah. So economical also. Tell your partner or tell your wife lokun say bosui lah. If you want to order beef steak, wagyu steak, can SI. But we share lo. Save your money also. So you can taste it, but health wise, try to reduce the intake. 70 grams per week lah. 70 grams per week is like 2 matchboxes. Yeah, but chicken no limit. You can take the kampung chicken the normal Sungai Petani chicken no limit one lah. So you can take chicken, you can take fish also no limit. The other seafood also no limit lah. Yeah, enjoy your food lah. And to cut down your risk of breast cancer, please do breastfeeding. Of course lah, for those who have children lah, no children, how you have to breastfeed lah. So male also cannot breastfeed. Interestingly, there are cases of male breast cancer. So out of 100, you get 1 male breast cancer. Strangely, I see a lot of male breast cancer coming from the Seberang Jaya area. Is it because of industrial area they are exposed to some chemical? I don't know. So possible lah. So I have seen a couple of male breast cancer as well lah. So male also, for the men also, please check your breast from time to time lah. So for the female, if you do breastfeed, you are cutting down your risk of breast cancer. Pregnancy also reduce the risk of breast cancer. So the more children you have, the less risk for you to get breast cancer. As long as you're breastfeeding, very hard to get breast cancer. So it's advisable for women to breastfeed for 2 years. Okay, how about supplements? You don't need any other supplement apart from what I've mentioned, like vitamin D, healthy food and so on, but exercise, you don't need anything else. No need to spend money to buy supplements, all no need lah. They come to my clinic also, they say, hey doctor, you promote to your patient, then we give you commission. I said, I cannot do like that. We are not going to do like that. I don't want your commission.
And sell insurance. And sell insurance.
Insurance will cover supplement insurance will cover. But sell insurance also, normally I think there will be like conflict of interest also. So
before lah. It's not after jumpa you, no chance already.
Yeah lah. I think if rather than doctor selling insurance, better I refer to you lah, Phoebe. Any patient need insurance, I refer to you lah.
Scam under table, doctor.
Ayo, cannot lah. So we better focus on what we do only lah. Okay. So what we want is a healthy living. We do exercise and so on. That one is very sui. And bring your family out. Go for adventure. Go up the Penang Hill if you want. Go up the Gunung Jerai if you want. Have a good weekend. Don't weekend in front of TV lah. So lazy lifestyle is associated with cancer. Active lifestyle is associated with good life loh. So if you look at, there's one island in Japan called Okinawa. In Okinawa is in the southern part of Japan, and they receive a lot of sunshine. And people in Okinawa, they don't like to stay in the house one. They like to go out in the morning. They like to look at the plants. Most of people in Okinawa, they live more than 100 years one. Good health one. So they get vitamin D. They live a good healthy life, and they don't actually bother with too much of the modern day stress, you can say lah. And whatever we want to do, we start with a positive mind, will give you a positive life loh. Basically, if you want to start your life with exercise, start your life with good food also, it starts with your own initiative to have a positive mind. If you don't have a positive mind, you cannot do all these things, because the exercise will not fascinate you. The healthy food will not fascinate you. You will go for the unhealthy options. Huh? So with that, short, simple, sweet, I end my talk. And let's go on with the question and answer.
Okay, thank you, doctor, for the we said quick and sweet. Actually, it's quite, I mean, we say straight to the point, the point that actually quite common of us wish to know. And also the most important thing that always tarik my attention, doctor punya Hokkien, sui,
SP boy ma, we grow here with friends all, with Chinese, Indian all, SP friend ma.
Yes.
SP boy.
Most of the term that doctor using for Hokkien already, not familiar. Let us very familiar.
Yeah.
Okay.
I budak
So here
pekan lama Sungai Petani mah.
Oh, local. Okay. So for here, actually, we open the session for everyone. Okay. Sure. Anyone actually wish to ask any question that related to the doctor profession, you're always welcome. And just open your mic, and everyone can start with the question. But maybe before that, I use my authority of a bit. I ask first. Okay. Before then, at the same time, you guys can prepare a question. Then I come back faster. Doctor, here I want to check. Actually, we have always heard people say, those chow hui da thing, the burn food, the food yes, that's the thing. Is it the myth or actually got scientific logic also? Can doctor share about it a bit?
Yes. Very good point. So the cha food, the high flame food, is actually thought to be associated with cancer. So if you are cooking the medium flame, okay, no problem lah. Low flame is high, no problem. But high flame like char kway teow, things that cook very fast one lah. 3 minutes, sometimes you see the wok also, flame coming out from the wok. It generates a lot of carbon. And we are consuming the carbon, all the char one. You see the char kway teow very nice, all the hitam one. That one is actually is poisonous for you lah. The other thing like satay also, you char one ma. The problem with satay, they coat with sugar. Satay they coat with sugar and then they burn the sugar. So the problem is when you burn the sugar, that one is toxic. So you never burn the sugar. Never burn the sugar. Like if you want to cook satay also, don't put the sugar coating. The problem is most shops, they put the sugar coating to make this nice look. Yes. So one, you have to be careful. It's very good point. So I normally advise my patient the cha one better avoid lah.
Then can I understand that actually caramel also consider
very good point.
High risk food.
Yeah, you actually. Yeah, you are reading my mind already. You're scary like you.
The
So yeah,
Caramel also consider is the food
high risk food lah, because they burn the sugar into
burn the sugar
then become caramel, you know.
correct, correct.
Oh no.
Correct.
So I think I will stop my caramel food, but it's actually quite too sweet lah. I actually reduce a lot also. Too sweet.
Yeah. I
Okay.
well, I admit caramel can be nice. As you say, it can be too sweet. But the good thing about caramel is we don't take it very often.
Yeah lah, don't take it.
Yeah,
If moderate, still okay.
moderate is okay, absolutely. So if you go to the best cancer center in the world, New York, London, and so on, our practice is we will never say no to any food. Meaning you can have all the food. If you want the cha-cha one, occasionally, no problem, because the body, God has designed your body can withstand some challenges. Meaning once in 3 months, if you have caramel, is it going to do harm to you? No, definitely no. But the not so, even in US or in UK also, if you want to enjoy your snack food or your some people's food also, you can, but don't do it often. So the good food, make it frequent. The not so good food, sometimes you're craving for it, no problem.
Okay.
But do it often.
Okay. So also a last thing, when we come to the barbecue or those thing, the cha-cha food, especially those that actually we said burn already black color one, that actually we encourage to remove it, right? We don't really sedap with so crunchy, then I eat it.
I think the burn one, you just don't remove the meat. You also have to remove the chef also lah. Meaning the chef who do the barbecue not very good one lah.
Okay, understood. So make sure we don't consume it lah, that kind of thing. And also remove the chef. Correct.
The chef also lah, because it's not good in preparing barbecue.
Don't do barbecue party. Don't do.
Yeah, if you want to. Actually, coincidentally, yesterday I was reading a book on 2 days ago I was reading a book on barbecue menus and so on, cooking one lah. And actually, the barbecue cooking must not be overcooked. So if it is like black one, meaning you are not a good barbecue cooker lah. So if you of course you can do your barbecue party, but get a good chef lah.
Okay.
Thanks, doctor, for the clarification and also the good info for us. Okay. Come on.
Inside
we have
question,
Yes.
Inside
Come on,
question.
Come on, let me check the chat over there.
Can I ask a question?
Here.
Can I ask a question, doctor? I'm done here.
Can, Mr. Tan.
Doctor, just now I saw your slide. But one more slide is no need supplement. Can you explain that? So nowadays, all people going to buy a supplement like vitamin A, B, C, D, E, F, G. So can I know why no need supplement?
Okay, so the supplement, if you are taking for general health, that one is acceptable. If you are taking supplement to prevent cancer, a lot of patients, they are taking all the bogus supplement. That's what we mean by the supplements. I have patients who spend around 6,000 ringgit every month on supplement.
Too many. 6,000.
Lak chap cheng per month. So lak cheng per month, and then she takes 80 tablets per day.
Tablet.
Yeah.
So
yeah.
18 tablets still come to look for you, is it?
She got cancer,
That's the logic.
80, not 18, VB, 80.
80
pack chap tablet per day.
for you.
80 80.
So I still remember she come from Perlis and she got stage 4 breast cancer. She said, doctor, I admit I have been medicating myself with supplement. I pay 6,500 ringgit per month on 80 tablets. So we must not do that. If you're taking vitamin A is good for your eyes, If you are taking vitamin B good for your memory. I myself, if you are having a hectic life, meaning you are very successful person, very hectic life, bolat, then you can take vitamin B. I myself, I'm taking vitamin B for that lah. So it depends on the purpose of you taking the supplement. If you're taking for cancer, the only one that you can take is vitamin D. That one also, if you don't have time to exercise outside lah, to get morning sunshine. Still, morning sunshine is still better and the best compared to taking the oral one loh. But if you're working in office, working in bank 8 o'clock have to 9 o'clock have to go in. You have no chance for morning sunshine. So that one you can take vitamin D lah. So what we meant is, don't take for the sake of cancer those kind of supplements that people are selling, which are very expensive, which are very unsubstantiated, no scientific evidence one. So there are a lot that they are selling outside lah. What's more better is your natural fruits, your natural life. That one is the best.
Okay, doctor. Here also related a bit to the, okay, thanks Tan for the question. Here actually I go through the chat just now. Also some of our actual attendee actually have a question that related to this topic also.
Yeah.
Like our Miss Angie actually asking, too much supplement added burden to the liver, is it?
Absolutely. So all food that is being processed, that one is being processed either in the kuah or in the yochi. Either one lah. So if let's say if you are taking too much, your liver will kacau loh. We have had patients getting liver failure. Once you kena liver failure, 50-50 chance your liver can recover. So you can either die because of too much of supplement also. So very, very good point that you have. I've had one patient, I remember, taking supplement, too much of supplement from the sensei one. He got, I think, pato cancer. He had to be admitted for 2 weeks during Chinese New Year. People celebrate Chinese New Year at home. He celebrates Chinese New Year in the hospital, not because of the cancer, but because of taking supplement. He got very bad mouth ulcer until the own thumb also cannot swallow. The own saliva also cannot swallow. Pity that guy for the kuah all gone already. So very, very careful with the supplements.
Okay. Also, actually, doctor, we have another question from Angie also. Here, she asking that, do microplastic in food associated with cancer also?
Well, it's another good question. So microplastic, it doesn't get absorbed into your bloodstream. So microplastic will expose you in your gut, in your bowel. Now, the microplastic element can cause inflammation in your bowel. It can lead to cancer.
Okay.
So the microplastic is bowel cancer that we worry about.
So hope this clear our Miss Angie question. Actually, we have a next question also, doctor. Because from our Joanne, she asked that actually doctor said chicken we can eat actually a lot, even without no limit, yes. But she asking that chickens nowadays actually like maybe have patiam, they put some maybe additional growing fast one. So is it any advice on this kind of thing?
Sure. I've had a friend of mine. He works as a veterinarian, industrial veterinarian for companies basically. So basically, we understand that people say we all chuchuk all the chicken one lah. We say that one not logical. No, I say not logical. They say, doctor, imagine in my farm we have one farm got 30,000 chicken. Can't we want to go and chuchuk one. That's why impossible lah. That's why. Unless the chicken is not well, then we chuchuk them low. But if they are well, we never chuchuk the chicken one. So it's actually a myth. It's actually a myth. The food that made them fast growing is actually the high quality corn. The corn grain that they import. That's why chicken is expensive, because the corn grain is not a normal ordinary corn grain. You have to import from the US one. According to my friend. So that one will make them grow fast. So like Angmo take the corn grain and you see how their body is. So we have the corn grain Angmo one, our chicken also grow fast now.
Okay, actually, from this question also remind me of something that I asked my friends that actually handling the chicken farm, because
Yeah.
last time they said when we eat the chicken wing, they said I eat the drumstick part, the wing I don't eat
Yes.
because they chuchok at the wing part.
Yeah,
Then
yeah.
then my friend that actually he said, "Wow, you see, the chicken is the size like that now. You need to purposely get the wing and chuchok there. Wait,
Wow, very difficult.
30,000 chicken there, So
Yeah,
it's
exactly.
impossible we are doing like this."
Exactly.
So hope this clear the myth of
Yeah,
everyone's
yeah,
thinking.
yeah.
Also, we go through any scientific proving thing. Okay, that's good.
Exactly.
Also,
Exactly.
okay, then doctor, here we come to the next one from our Lam Chiu Hui. Actually, doctor, he's asking that is it normal if there is blood clot during period?
Yeah.
Is it a sign of cancer or other disease?
Okay.
Blood clot.
Yeah, blood clot is like the white becomes very solid one. That one is normal. That one is normal during period. But if your period is change in pattern, suddenly your period normally are not heavy, but suddenly become heavy. That one you need to see your gynecologist. So any change in your normal period pattern, have a low threshold to see the gynae. But the blood clot itself is not a risk for cancer.
So basically, it's good that always we observe the train.
Correct. Right.
Okay. So, and also a second question that she asking that how much is the cancer screening cost in Pantai Hospital?
Okay, there is no such screening as cancer screening.
But it's for pap smear, all those smears,
Yeah.
like cancer marker, all these
Cancer
things, right?
marker. Yeah, I think to clear the myth, actually cancer marker is not something that we advise because cancer marker is not accurate. Meaning if you are normal cancer marker, doesn't mean you don't have cancer. So we never do a cancer marker if the patient got no symptoms, no. But let's say you want to do mammogram for breast cancer. Yes, once every 3 years you can do mammogram. We have a free one, free mammogram that I think they offer 1,000 patients per year, free mammogram. If you are paying for it, it's only like 200 ringgit, not expensive. So if you're paying for pap smear, it's around few hundred still. If you are doing for pato cancer, you just have to check your stool, send your sai for the to see any blood or not. That one is around 100 ringgit. So the simple one are not expensive. Check for prostate cancer, then you can look at a tumor marker. But if you want to be thorough to see, oh, doctor, my family 7 of my family member got cancer. I need to fully check my body. Then you need a full check. Then you need a CT scan. CT scan is notching 2,000. Blood test another 500. So if you want a thorough test to make sure that you don't have cancer, 2,500. Then you have to do a scope, upper scope, lower scope. The upper scope, lower scope is another 3,000. So it can a full super full check can go up to 6,000.
Okay, understood, doctor. Okay, so thanks, doctor, for the sharing on that. Also, here we have some new question. Okay, before the new question, also here actually got a question that our Mr. Thor asking. People said air flyer. Initially, I thought it's what flyer. Actually, it's fryer, FRYER. Air fryer will cause cancer also.
Yeah. So
Air fryer.
This is a new myth saying that air fryer can cause cancer. Actually, it's not correct. So air fryer is actually fairly healthy. The concept of air fryer is it uses the meat's own oil to cook it, and the way it cooks it using pressure. So basically, at the moment, there's no scientific evidence to say that air fryer can cause cancer.
Okay, thanks, doctor, for the clarification. Okay, here's also we come to the next one. Here's also our NG asking, nowadays busy lifestyle, a lot of people take away tapao. Then do the microplastic can fill up the cancer progress?
So the microplastic at the moment, there's no proof to say that microplastic can fuel up the cancer progression, no. But we worry for the pato cancer. So if you have breast cancer, can microplastic make your breast cancer worse? No. Can microplastic make your cervical cancer? No, because it doesn't reach there. The most it can reach is your stomach, is your patona. So this one, it may. But the thing about microplastic is still we don't have much evidence to say yet.
So it's just like doctor just now mentioned about the bowel or maybe even the stomach. those few part that actually
Yeah,
have some
direct-
contact with the
have the
microplastic.
contact one. Exactly. Yeah.
Okay. So here we have the next from the Phoebe. Then actually, she's asking that after cancer cure,
Yeah.
PET scan for follow-up is still covered under insurance. Is it
What-
like doc?
Okay. Once the insurance company know that patient is cured, automatically
It won't cover.
Go cover. Once
no.
the insurance company will ask, when we apply GL, then the insurance company, oh, you want to do PET scan? The next question, is the patient in remission? If the patient in remission, automatically go cover.
Oh, then you say no lah, not yet lah.
Yeah, so yes, I think this is currently all the cancer doctor in Malaysia are debating it at the moment lah.
Oh.
And what we are using now is we are not saying remission. We can tell the insurance company from the CT scan no evidence of disease. But it doesn't mean that patient in remission. So we have to use a different term. Then the insurance can cover lah.
Oh, okay. Use the different term. Understand?
Yeah. So when they apply for GL, if they ask back, so the doctor has to use the right term lah. If say patient in remission, automatically will cover.
So this one we pass back to the doctor. We said the professional term there, the writing there. Okay, here's actually is for the follow-up part. Then how about we say the pre one? Like today, maybe after we meet doctor, then doctor suspect we will have some of the symptom. Then all this actually doctor can help to consider medical necessary, is it, to claim for our PET scan, MAR, all these things.
Yeah. We do have, if getting the claims like pay and claim, we can do for PET scan. If within the 90 days or the 120 days after the treatment, most of the cancer treatment, the scan will be after 90 days. And also now we have the outpatient cancer GL as well. Most of the companies are having ready, so you can claim from that as
well. Okay, so here actually we have the next question from our Miss Siling Ong, that actually she's asking, nose cancer can be totally recovered after all treatment has been done?
Yes. Nose cancer is quite common in Malaysia, and the cure rates are high with radiotherapy depending on the stage. Yes, we have had patients where patients totally recover after all treatment being done.
So hope this will clear Miss Ong question. So here we go to the next one from our Catherine. Actually, she come back to the chicken and the farm. That she mentioned that is it that they are using gas to put inside the farm, such as seal off place for several days. So hopefully this one maybe next time we can have our profession from that industry to come to let us know.
Yeah, I also don't dare to answer this one. I also don't know.
Yes, maybe they are.
Meaning to say that they are putting the chicken in the Hitler style gas chamber.
That one maybe we come to the operation part of their chicken farm. Hopefully we have the expert from there in some time. Okay, here we come to the next question from Phoebe, that she asking that HPV injection only take one time for whole life. If age 13 no take injection, is it now we can take it, or where to take, or doctor can recommend?
The ideal, if you look at the cervical cancer, there are two peaks, meaning you can get cervical cancer at the age of 20 to 30 or at the age of 50 to 60. So you have to take the prevention earlier than that age where the cancer occur. So meaning to say the best age is before 20.
And before 20, then if before 20 we didn't take the injection, then now take can?
You can still go for the HPV. Yes.
Oh, where to take it?
In your GP clinic. So the GP clinic, you don't. Most of the patients will go in the clinic lah. They rarely go for HPV in hospital.
Okay, no problem. Take once a time in the lifetime only lah.
Yeah.
Okay.
There are few brands, depend on the brands that you go for. So there's a booster dose, there's a non-booster dose. It depends on which one you want. Just like COVID vaccination, something like that.
Oh, okay.
Okay, so Okay, so thanks, doctor. So actually, we saw actually Miss Angie actually sharing a bit on the HPV inside the chat box there, so people can go through on it.
Yeah.
And last but
Mm.
so is it correct,
Yes.
right?
Yes.
Okay. So last but not least, also from our Miss Angie, that big blood clots associated to fibroid but not cancer, is it?
Exactly. But the thing is, fibroid, you need to make sure your fibroid is not cancer. So that's why to confirm fibroid, the doctor has to take a sample of the fibroid, send to the lab. Because cancer can look like fibroid can look like cancer. So unless you take a sample, then you know.
Okay, that's mean really need to check the sample, only we can justify that. Is it cancer, is it benign, or actually malignant, something like that?
Because sometimes fibroid can mimic like a cancer.
Understood. Okay, here also we are almost at the end of our question, and also last but not least, a bit from me also, that actually, doctor, I want to ask about the endometriosis.
Yeah.
Okay, for this thing, actually, is it like having the risk of recurrence or anything, or even will lead to the cancer?
So endometriosis is the inflammation of the lining from the ovary
Of the uterus. Okay.
to the uterus, and the lining usually will lead to pain, will lead to discharge. Now, the link to cancer is not direct, but is indirect. Any parts of your organ that is consistently inflamed, that can eventually lead to cancer.
Okay.
In endometriosis, you have pain, no? If the pain is persistent, it gets untreated, that organ will be inflamed. The more it gets inflamed, the more the risk of cancer happens.
Okay, so the main part will be the inflammation. So
Inflammation.
Okay.
So endometriosis doesn't cause cancer directly, but indirectly, if the inflammation is not being taken care of, it may.
Okay, understood, doctor. But so for this endometriosis, actually the recurrent will be coming. Is it even after removal?
Yeah, you can still recur. Usually, sometimes after menopause, then it gets settled down.
Understood. Still the hormone is still there, so
hormone
actually
is still
all
there,
of this, all the chances is over there. Okay, here actually we have the closing of all the questions given. So here actually, does our doctor have any, like we say, closing or any advice or any last word you want to give to us before we close the session?
I think I really enjoy the talk with all of you. We've had a very good navigator as our chairperson, and we have a very good educational and enjoyable questions as well from the audience. And I really enjoyed the discussion, and I think all of us we just have to look after ourselves also lah. Don't work. Look after our health. Have a balanced life, and help each other to remind each other to have a balanced life. Also our clients also, and I think we can. Cancer is our common enemy that we have to work together lah, from the prevention until to the treatment.
Okay, thanks. A sweet advice from our Dr. Shazril from Pantai Hospital Sungai Petani. So for our audience,
right?
Yes. So actually for our participants, so if any really we said have any we say a particular or we said more physical specific thing, we always welcome everyone to visit Dr. Shazril at Pantai Hospital there to consult him for more details in case you need his advice. He'll be there. So okay. So I think here we almost come to the end of our today's session. But before that, do we have any we said the photo session and also our thank you certificate for we make it virtually. So come on, our technical team, can you share? Okay, so
Angie said, "Doctor, thank you because treating her mom."
Ayo.
I know who lah.
Yes. I just met Angie just now.
okay. So,
thank you for the certificate.
Okay, so doctor, so please have a wait. Okay, we have a screenshot. So, Vincent, are you okay there? Or Ashley, already done?
Yeah.
Okay.
Ready?
So here also.
1, 2, 3. Okay.
Okay, thanks, doctor. And also, can we have a group photo? So for those that actually are open our camera, can have a group photo with doctor to capture the good memory for today and also the meetup of the day. So I'll pass for Vincent there. He will lead us.
Yeah. Wait, yeah. Okay. 1, 2, 3.
Okay, cheers.
Okay. One more. 1, 2, 3. Okay.
Okay.
Doctor.
Okay, thank you, doctor, for your time today.
Thanks for your
And
time
also
as well.
thank you.
Much
Also
appreciated.
thank you. Yes, also thank you, Kaiza, for coming with us today.
Doctor want to
Thank
relax
you.
already.
Thank you. Thank you.
Okay,
Thank you, Doctor.
Okay, thank
Thank
you.
you.
Good evening, everyone.
good
Good
evening.
evening.
Okay. Bye-bye.
Bye
Bye
bye.
bye. Bye bye, doctor.
Bye.
Okay.
Okay. Afterward, you can send me the snapshot
Photo, right?
photo.
Don't worry.
That's not
Yes.
my
Okay.
no problem.
PIC will send for
Alright.
you.
Thank you. Thank you
Doctor
very
say
much.
Okay.
makan relax.
Okay. Thank you,
And then
Kaiza.
next time if you need any new doctors or other topic, you can just require for me lah.
Yeah,
Okay.
no worry. We'll keep
Alright.
contact with Kaiza.
Yeah.
Thank you
Okay.
and see you
Thank
on
you.
coming Thursday.
Okay. Yeah. Okay. Bye.
Okay, bye.
OK，
OK，所以其他伙伴应该也谢谢大家的出席哦。当然有疑问的，有想要市场问题那些的，我们可以继续
我
留下。
们可以留下来了，9点15分嘛了。
如果有东西要问啦，
可以
这
开。
房间没有关。OK， 已经没有我们的同胞，有猪同胞在了。
当然不是 cancer 的问题啊，cancer 的问题我们不会回答，市场问题我们可以回答。Hayden， 哇，远哦，你飞来呀？
本来 Hayden 要进来
，Hello，
要进来借房间呢，借下就跑进来了。
哦，借房间呐，是借什么？
借下被放飞机在那边，顺便听一下哦。
哦，这样啊，借房间还只要借到也是 OK 啦。我们这个北区他很出名的这一个医生。
好邪啊！还讲福建话这样。
你可能都不能噻。
对，还要这样来参讲，真的是他一定有一定的年资的味道。
哦，他讲到那个 wave 那个电到很准呢。Normally 如果他只是为了应酬我们，他不会讲到这样准的，他讲得很顺啊，已经很 normal 了。
他整天跟安迪讲的，这家伙也是他 trade 的嘛，他也是跟他讲常福建话，他又会听。
这就 friendly 很多。
是不是？
OK。
我们是今年凯翔 Catherine 有什么还要问我们吗 ？Catherine？
那个鸡的问题，我们是暂时没有办法 solve 啦，没有办法。
有了，我们叫 Ashley 的老公来讲一场养鸡的，怎么给他鸡吃哈？我们等下不敢吃鸡了咯。
没有，我老公的答案也是跟刚才 doctor 讲的一样的 ，OK， 也没有什么打针那种啊。
哦，是没有。
方言也没有啦。
那个喜欢讲的也对哈，哪里有整天
方言也是没有，
抓到就插下去了。
有插也是随便插了的嘛，所以
随便乱插，他还要打翅膀，打不到，打到自己的手里，
是不是？就是那个养鸡的人笑我讲，你吃一个鸡翅膀也要吃到这样用吃啊你？笑我。
你跟鸡翅膀个会爬落去哦。Catherine 要问问题啊啦，吵死人了你们。
没有问因为我今天本来是有 planning 要约人的，但是临时昨天我meet完青鱼鸟过后，我的 HR 就之前的工作那 HR 就联系我了，就讲一些交际的东西啊，然后我又要去啊，然后今天早上就跑劳工部，然后下午又去之前的公司那边去处理。
哦，他也叫你回去是吗？
不知道啊，他们朋友就说一些